Okay. How y'all doing today?
Fantastic.
Okay, so could y'all tell me the reason y'all came in for y'all visit today?
Talk, Ari.
One more time.
My appointment for
Oh,
the
okay, for your pregnancy?
yeah,
Okay. All right. Do you mind handing me your ID real quick? That way I can log you into the system.
yeah.
Okay. NRP, you gotta go into your backpack. That orange ID slide it to my body. Okay. Give me 1 second. Okay. So just real quick, I'm gonna do a couple vital signs real quick. I'm gonna check your blood pressure, heart rate, temperature, your respiratory rate, and then your height and weight. Okay.
Okay.
Okay. Your blood pressure seems to be good.
May I take a second to go use the bathroom?
Yes, sir. When y'all let him out the room for me, please. Okay. Your heart rate seems to be a little elevated. Nothing to worry about. Okay. Temperature is fine. Your respiratory rate seems to be okay. All right. Stand right here for me real quick. That way I can check your height and weight. Okay. You can sit back down for me. Okay. Miss Ari. So I'm just gonna ask you a couple of questions real quick. Um, Miss Queen, could you sit down for me right here? Um, on the computer. That way you can log everything into her my chart. These questions that I'm fixing to add. Okay. So first question. So when was your last menstrual period?
A month and a half ago.
One more time.
A month and a half ago.
Okay. Have you been feeling any nausea or vomiting?
Yes, I have.
What about any breast tenderness?
Yes, that a lot.
Any fatigue?
Yes.
What about frequent urination?
Yep.
Any pelvic pain or cramping?
Yes, a little.
Okay. Have you been having any vaginal bleeding or spotting?
A little.
Okay. Um. So, Queen, please update her my chart. So real quick, just to review some medical history. Um. So your menstrual cycle, um, Would you happen to know the date, the last date you were on it, or no?
No, I don't.
Okay. And how about your sexual activity? Are you sexually active?
Yes.
Okay. Um, do you have any medical conditions that I should know about?
No.
Okay. Any current medications that you're taking?
Not at the moment.
Okay. Any allergies? Anything like that?
Nope.
Okay. Step into this room real quick. You can update her my chart again off of those questions as well, Miss Queen. Okay. Could you sit on the table for me, please? Okay. Right there is fine. Okay. So I'm just gonna perform a physical examination real quick. And then after the physical examination, we'll go into your urine test.
Okay.
We're doing an RP class. Can you please exit?
Yes, Miss Flora, this is a RP. Could you please exit out of the room? Hold on. NRP. Let me pause this RP real quick. Okay. Okay, I'm just performing your general physical assessment. Everything seems to be good. Let me see.
Bro, hey, come, let me out this door, bro. Dumbass bitch.
What?
Bro, she fucking locked me in this room, bro.
Okay. We just performed your abdominal examination. So I'm gonna have Miss Queen. She's gonna give you a urine test, and then she'll collect your urine test real quick. That way we can run that through the system. All right, Mr. Jackson. I just ask if you stay here. We can't really open and close this door too much, so please just remain seated or go in there with her for the duration of this appointment.
I'll just sit right here.
Close the door real quick, Miss Queen. That way she can use the restroom. Hey, 38, brother. We in the middle of a RP, brother. So could you go to floor 2, floor 0, or to the back hallway? Okay, she says she done, Queen. Could you go in there and collect the urine analysis? Okay. Update her my chart and then send the urine off to the lab.
Yo, Lewis, can you look upstairs and see if there's a fire up on?
Okay, it usually takes a quick second. It isn't gonna take too long till we get the results back. So just be patient with this real quick.
Ari, Ari, you cheated on me?
Boy, please.
I hope I'm the daddy.
Absolutely the fuck not.
Oh, you ain't saying shit like that, is it? So you just playing me?
Talk to your wife.
Fuck my wife. So you mind? Yo, Freddie, you can invite me to the medics. I was a I was white scrubs last time I was in.
No, sir, I cannot. But I am in the middle of a RP, brother. So could you please go to the lobby, brother?
That's my bad.
Okay. Um. Okay, I think these are the results right here.
Oh my god, bro.
Okay. So Miss Ari, I did receive the results, and it is confirmed pregnancy. So you are pregnant, but one thing that we need to do is schedule you an appointment for an ultrasound. Right now, I can't conduct it as of this moment, but I will schedule you an appointment. If you give me 3 days, I'll reschedule you an appointment, and then we will basically go from there. I'll have you come in, we'll do your ultrasound, so that way we can estimate and determine how far along you are within the pregnancy. That way I can give you an official date. But other than that, I'm gonna start you on some prenatal vitamins. That way, that's what's gonna help you throughout your pregnancy. As of right now, I would estimate you probably at about, maybe right now, 2 to 3 weeks off of you saying it's been a month and a half since your last menstrual cycle. So I'll say you're about 2-3 weeks right now. But when we schedule this ultrasound and we get to actually look at everything and we go in, the machine will give me a better definite answer on how far along you are.
Okay.
Until then, I just recommend you staying away from certain foods and things like that. Let me go into this system real quick so I can tell you exactly what you need to stay away from. And you do have no drug abuse, no nothing. You don't do drugs or anything like that.
No.
Okay. Okay, so a couple things you want to avoid is things like alcohol, smoking, and vaping, recreational drugs, medications or supplements without checking with us first, unpasteurized milk, cheese, and juices, high mercury fish, raw sprouts, excessive caffeine. Generally, keep your caffeine below 200 milligrams per day. Stay away from hot tubs, saunas, and activities that cause significant overheating. And also activities with a high risk of falling or abdominal injury. You just want to stay away from certain things like that because you don't want to risk, anything happening to the baby. Also, make sure that you contact me immediately. I'm gonna try to get to the point to where I could have Miss Queen as your doctor. So, but as of right now, I am your doctor. But I just want you to make sure that you contact me if you're seeing anything like heavy vaginal bleeding, severe abdominal or pelvic pain, fainting or severe dizziness, severe or persistent vomiting, an uncontrollable fever, higher than 100. So whether it's 102, 105, whatever, things like that, you want to make sure that you come in. If you're having trouble breathing or chest pain, severe headache or vision changes, or when it comes to later in pregnancy, noticeably decreasing fetal movement, because that's not normal whenever we get to the point to where the baby is moving around. Did you have any questions about anything?
No.
Okay. Miss Queen, could you do me a favor? Could you type up her discharge papers real quick? Okay. So, Miss Ari, you are free to go. I would like to see you soon for a follow-up appointment. Please see the front desk for your next appointment, discharge papers, and take-home medications.
Okay.
Thank y'all so much for coming down.